Hi, everyone. I'm Alex Spicer. I am the editor of CentralTrack.com. Shortly, we'll be joined by U.S. Congressman Colin Allred to talk all things COVID-19, but a couple other things too. The future of sports. Maybe even his favorite Dallas restaurant. For those of you who don't know, he is the representative for District 32, which covers Park Cities, Richardson, Garland, other areas of North Texas. So it'll be interesting to see what his take on everything is right now. Try to pin the comment. Okay, I'm going to try and pin so everybody knows. And it looks like he's here. Cool. Should be any second. He's here. Just waiting.
Hey,
How's it going,
I'm
Congressman?
I'm good. How are you?
I'm good. Thank you. Thanks for taking time out of your busy schedule to talk to us. I know you're probably insanely busy right now.
Yeah, we've got a pretty big bill tomorrow that we're going to be voting on.
Yeah. And we'll talk about that. Where are you quarantining? Are you in DC, I assume?
We're here for the vote. Yeah, so we're got to go in and see if we can get this relief passed.
Yeah. So have you been back and forth a lot then between DC and Dallas, or have you mostly been home?
Yeah, back and forth. We've had a couple of votes,
Okay.
but obviously quarantines in both places, basically. So
Right. And you're a dad. Do you worry about, potentially exposing, your family to going back and forth?
yeah, I have a 15-month-old son, and his favorite thing is to put everything in his mouth right now. So that's kind of a different challenge, for travel and things like that. But I try to take you know incredible precautions. Take off all my clothes before I touch anybody. Wash my hands, and also, of course, when I'm out, I try to avoid getting too close to folks because obviously my wife is at home, and if one of us gets sick, then it's going to be all on just one person to not only watch the baby but
Yeah.
then deal with caring for the other one. So this is what I think parents across the country are dealing with.
Yeah, I could not imagine having a kid during all of this. I'm going insane just, myself. I'm quarantining in now Lexington, Kentucky,
Okay.
because I live in Dallas proper, but I left when things started opening back up on May 1st, just
Uh,
because I I didn't want to risk, potentially. I'm lucky that I can work from home,
mhm.
but I just didn't want to risk, um, you know, potential infection from things slowly opening back up. So I came to stay at my dad's place in Lexington, Kentucky, just because they're a lot more. I feel pragmatic with the way they're opening things up here. So I was staying home up until then in Dallas, and then when that happened, I was like, I gotta get out of here. So
Yeah. Yeah.
um, I wanted to talk to you though about reopening. We saw, at least in Dallas County, the day after Greg Abbott announced that we would be moving into reopening phases, Dallas County saw some of its highest case numbers since this all started, and highest death rates as well. Um, I'm curious to know what your thoughts are on that, because a lot of experts are saying that it's not completely safe to open things back up until we've seen a consistent 14-day decline in cases. That hasn't been the case specifically for Dallas County. So what are your thoughts on that? Do you think it's premature? Are you optimistic?
Yeah. Well, listen, Alex, first of all, neither of us are healthcare experts, right? We're
Right.
not epidemiologists, we're not virologists, right? And there are folks who have been studying this their whole lives. They've committed their professional careers to understanding how to contain infectious diseases and how to prevent folks from getting ill and dying from them. And what they have told us is that you need to see a sustained period of decline before it's safe to reopen. That's not, my opinion or your opinion.
Right.
That's the experts, right? It's the same thing if you go to your doctor's office and they say, you really need to lay off eating this type of food. It's bad for you. It's going to make you sick. That you would take that advice,
Right.
and it's a shame that we have not been given the chance in Dallas to protect ourselves because we knew in about mid-March from the projections, maybe late March, that late April, early May, mid-May was going to be our peak.
Hmm.
We knew that that was going to be the peak. Clay Jenkins and the Dallas County Health, Dr. Wong, we knew that was when it was going to come. And so the governor jumping ahead and forcing us to reopen when we're in the midst of our peak is for us certainly not the right time. Now, you can say, well, in other parts of Texas, there are different things going on. Well, but we're one of the biggest metroplexes in the country, and we are in the midst of our peak, and we need to be able to, protect ourselves. Now, that being said, you can still to protect yourself and your family and take steps to do that, regardless of what the governor says or what else is happening around you. And so that's why, I think Judge Jenkins and Dallas County have rolled out this kind of color-coded system to tell you where, based on the experts' projections, we are in terms of how safe it is to go out. And right now, we're still in the red zone, which is if you can, you should shelter in place. You should limit all travel to only essential travel, only do essential trips, because we have widespread community spread of the virus in our community. And as you said, we're seeing deaths as well from this. And so, you know, I think that those of us who are in positions to be, legislators or to be policymakers, we're not going to be an expert in this field, but we should
Right.
listen to the experts. And that's what disappoints me is that, it's not about an ideology thing. It's not a Democratic versus Republican thing. It's not even about what you think about the economy, because reopening this and causing us to have a relapse is going to be worse for the economy. I think we should listen to the experts, and I think that this has come too soon for us in Dallas. That's certainly true.
Yeah. And uh, speaking of that, what the experts are saying to try and combat the rise in cases and deaths is that we need more. First of all, we need more PPE. We're understocked on that, and that, I don't think that's just. I think that's a nationwide problem. And we also need more testing done. And you actually successfully, with Representative Johnson, uh, submitted a letter to the Department of Health and Human Services, asking that our testing, our federally allocated testing in the two sites to be extended, and it worked, and now it's extended until June 30th. Um, so good job on that, first of all. But I'm curious to know what's next. What else are you prioritizing for, PPE or any other social distancing practices to
Yeah.
try and um, lower the spread?
Yeah. So what we're doing right now is the bill that we're going to be considering tomorrow has about $75 billion for us to hire an army of contact tracers to ramp up our testing and to help folks who need to quarantine safely. Because, a lot of people can't quarantine in their own homes from their family members.
Right.
If you're in a two-bedroom apartment and you've got three people there, you're not going to be able to quarantine very effectively. And so to use some of these vacant hotel rooms that are available to provide people to per diem so that if they are quarantining, that we're not taking food out of their mouths. And so that's really, I think, the next step for us is that we have to go on the offensive. You kind of have to think of this virus as an enemy, and that's what they do in South Korea, in Germany, in these countries that have been more successful than us. They really hunt down the virus, they track it down, and they try to pin it down and keep it from spreading. And South Korea and the United States had our first cases on the same day in January, and we've had now north of 85,000 deaths, unfortunately, and they're in the hundreds. They're at 4% unemployment. We're at Great Depression era levels of unemployment. and they're playing baseball. You're seeing that on ESPN if you watch ESPN, and so they're in a very different place than we are because they were much more aggressive about their testing, contact tracing, and isolation and quarantining and treatment. And so I think for us, we've done the defensive side of this, which is to shelter in place, to practice social distancing. That's important, and that's a tool in the toolbox. But the other thing is that we need to go out there and actively hunt this thing down, find out where it is, and try to help folks where we're seeing these flare-ups, isolate and keep it from spreading. That's the biggest thing I think for our economy is to give people confidence. I mean, you mentioned, that you don't feel comfortable going out. I have family members, my mom and my aunt, that are both in their 70s. They're breast cancer survivors. If they catch this virus, it's much more likely to be lethal for them because of their underlying health conditions. So they're not going to go out, not when you're seeing widespread community spread still in the area. And if they're not doing that, then they're not shopping at their local store. They're not spending money in the economy. And so that has an economic impact too. So I really think the best thing we can do for the economy and for our public health is to attack this thing. And I really want to see us be much more aggressive. We should have had a national strategy from the beginning to do this, but it's not too late. And it's never too late for us to try and do whatever we can. We may not be successful in totally limiting the spread, but we can make it so that people at least feel comfortable until we get a vaccine, which is going to be a while, unfortunately.
And so you kind of touched on this too. Your stance, or at least on health access and public safety. Your stance on healthcare is more of a Medicare buy-in, where people can buy into a government funded healthcare system, as opposed to a more privatized healthcare insurer. I'm curious to know though if this pandemic, I mean, if people couldn't afford health insurance before this pandemic, they certainly can't afford it in the middle or after a pandemic when they're just trying to figure out how to, get groceries. So I'm curious to know if this has at all changed your stance on Medicare for all, and the effects that we're seeing, through our healthcare system struggling to combat this.
Yeah. Well, what I'm dealing with is kind of the realm of what's possible, right? And what we're seeing right now is that as we're speaking, our Attorney General in Texas is leading a lawsuit to declare the entire Affordable Care Act unconstitutional. And if they succeed in that, then 20 million Americans will be kicked off their health care in the midst of a pandemic. Millions more Americans will lose all the protections that go along with the Affordable Care Act, like protections for pre-existing conditions and all of those things. And so, we're at very different places politically on what to do about healthcare. And right now in Texas, if the governor wanted to, he could expand Medicaid and insure about 1.5 million Texans right now, just by expanding Medicaid. And, we have about, 1 in 4 people in Dallas County who don't have health insurance at all. And so if they get sick, they're not going to be able to go to their doctor and say, I might need to get a test for COVID. And so they are going to rely on these public testing sites, or they might not go. And that's why we don't really have an accurate picture, most likely, of what's happening in our community, because these enormous inequities in our healthcare system. And I've been saying this, and I strongly believe this, that COVID-19 is just holding a mirror up to our society and just showing us what's going on in it. Who is being most impacted by this? Well, if you look at the hospitalization rates in Dallas County, 80% of the folks who have a job, who have been hospitalized, are essential workers, right? And so that means that they were working while we were sheltering in place. And we know from studies that have been done that our essential workers are mostly people of color. They're disproportionately women, and they're folks who are likely working on an hourly basis, or who, are not, let's say, wealthy, right? And so these are the same folks who are, in many cases, parts of communities that have the underlying health conditions like diabetes, like high blood pressure, that make this virus more deadly. And so the impacts of this are not equally shared. And those of us who can work from home are still working from home. But while we're reopening, folks who work on an hourly basis are being asked to go back to work. And so I want to see every single American have health insurance and have health care, which is really more important than anything. And I think the pandemic is showing us that what happens down the street impacts you, that we are interconnected, and that, if somebody is not able to access healthcare or take care of their families, that might make you a little bit less safe, you a little bit less free, right? And we are in a bad position to deal with something like this in Texas because we're the state with the highest uninsured rate in the entire country.
Hmm.
So we have to deal with that, and we have to make sure that keep the pressure up to build and build and build till every Texan having health insurance. In Massachusetts, they have instituted basically the Affordable Care Act just for the state of Massachusetts and covered all their gaps. Almost everyone is insured in that state. There's no reason Texas can't be like that, right? And so, I'm just trying to set up the policy incentives for some of our statewide leaders to do the right things. And that's what we've been working on in Congress right now. And, if we get the ability, we'll continue to expand healthcare and we'll try. And the biggest thing, of course, will be lowering costs. But while we're in this crisis, I think that we're seeing the inequities in our system and how that
Sure.
impacts people.
Yeah. So then, is that because you campaigned on Medicare for all originally, and now you've kind of walked back into the Medicare buy-in that I talked about. Is that Are the issues that you're seeing in our healthcare system, um, is that kind of changing your route of how you think? Is Medicare for all maybe still your goal down the line? I'm just curious to know where the disconnect
Yeah.
happened on that.
Well, back in 2017, like this term is kind of, nebulous, right? So we're talking, 3 years ago now. And, a Medicare buy-in, in my opinion, is that, right? If you have everybody has access to a public option that they can get into, that's what I was talking about. I said everyone should have the right to buy into, into a Medicare-like system. And, really what we are trying to do here is lower the cost of healthcare and expand it to every single person. And what we have to do to be able to do that is to make the pitch, to get enough people on board to pass it in the Congress and to expand it in our states. And we passed the Affordable Care Act, and Texas didn't even expand Medicare or Medicaid. And so here we are still today with the highest uninsured rate. And as I said, 1.5 million folks who could be insured right now if we would expand it. And so I think that my goal has been to find the areas that I can make progress in right now and chip away and chip away and chip away. And so, prescription drugs is a great example. That is the biggest cost for most folks. It's the thing we hear most about. I
Right.
have people all the time who tell me they can't afford their insulin or they're rationing their insulin, all kinds of stories. Seniors who are taking only half of their medication to try and stretch it out. Those kinds of stories shouldn't be happening in the United States. And so we had a big reform bill that we passed, HR3, to try and address the cost of prescription drugs by negotiating, lowering costs, putting basically the buying power of the American people on the side of lowering our costs. Those are the steps that we're going to need to be taking. But I think what the crisis is showing us, of course, as I said, is just the inequities that exist, and that even if you if you have these systems in place, there's always going to be some folks who are taking a greater risk or exposed to greater risk. And so what we have to do, in my opinion, is make sure everyone has access to care and then try to level our playing field, increase the ability for everyone to have the same chance, right? And that's what I really want to do. I have a belief system, basically, that there are ladders of opportunity that you have to put in place so that people can succeed. I was raised by a single mother who was a public school teacher, and those ladders are pretty simple. You should be able to have health care so that if you get sick, you can go to the doctor, get taken care of. You should be able to have access to a good education so you can pursue whatever profession is good for you. And then you shouldn't have anything in your way through discrimination of any kind, whether it's what you look like, where you come from, or who you love, or how you pray, so that you can chase whatever your version of the American dream is. Those are the
Well,
things that I think
but
we
then
have to establish.
you don't think that Medicare for all would solve all of those things you just talked about? You don't think that that's like I said, people were before this already struggling with their bills, and now especially people who have lost their jobs or had to take pay cuts.
Yeah.
Do you not see Medicare for all as a solution to that?
Well, I think that we have a different system here, and we're going to have a different system than other countries. We can reach universal health care and build our way towards as many people having access to a low cost, quality health care that, will look different than it does, say, in Canada or in the UK, but that is just as good, right? And you already have a significant number of our folks who are on Medicare. If you're 65 and older, obviously, I'd like to see us lower the eligibility age for that. You have Medicaid, which is covering folks maybe with a disability or
Right.
who are falling into the kind of working poor categories. And if you have a public option that's competing with private insurance, then you have the choice. You can decide, do I want to take this low cost government provided insurance that's going to be quality and my doctors will take, or do I want to maybe pay a little more and go with this private insurance? And I think that's really what we're probably going to end up with is a system that's a blended system where you have a choice, but everyone should have that low quality or low cost, high quality option. And for if you can't afford it, then we'll offer subsidies so that you can, the same way we do with the Affordable Care Act. So
Okay.
basically, you make it so that everyone can get into it. And if you want to pay a little more, or if you want to have access to, let's say, some different types, elective type things or whatever, then you can. And that's what you see in some countries as well. So, once you have a system that's based on healthcare through employment, the way we do, then it's very hard to make those changes without interrupting what people really want, which is they want to have, their doctors take their health insurance. They want to have good health insurance. And so we're in that system. How do we improve this system? How do we make it so that everyone can have access to it? It's probably not going to be possible for us to take what is basically a third of our economy and to reshape it overnight. That's not going to be possible.
Sure.
But offering a public option, I think, is something that will give people the chance to make their own choice about what they want, and it'll compete with those private insurers, so they'll have to lower their costs.
Okay. You kind of speaking to that, and you mentioned this earlier, with the new bill, the one you all are voting on tomorrow. What are your biggest priorities? I mean, do you agree with things like rent and mortgage freezes and UBI? I know that $2,000 a month has been proposed. Where do you stand on specifics on the bill?
Yeah, well, the biggest things in the bill are dealing with our state and local costs that have not been covered and that they have lost a huge amount of revenue. And why is that so important? I mean, for anybody who cares about public services that are being offered, whether it's schools or transit or your police and firefighters and EMTs, I mean, these are going to be deeply cut into by the revenue shortfalls that our states and our cities are going to be experiencing. Why are they having a revenue shortfall? It's the same reason that many of our businesses are. People are spending less. They're not out there. When's the last time you probably filled up the tank of your car? Just imagine how much revenue is not going into the state now because of that. And so Dallas, the city of Dallas, has already furloughed about 500 employees,
Mhm.
which is a tragic thing, and they're going to have to at the end of July, if they don't get some support, they're going to have to cut more and more deeply into that. When our state legislature meets next year, if they don't get this revenue shortfall covered, they're going to make deep cuts to our education funding. They're going to make deep cuts to transit funding, to transportation funding, these things that we really haven't funded well enough to date. And they're going to be, probably going in the wrong direction. So that's the biggest thing that's in this bill. I mean, that's the biggest chunk of money is to try and cover for all of our cities and states across the country their revenue shortfalls. And just to
So,
kind of, yeah.
sorry, I'm just with the previous package then, you just mentioned how, some entities probably haven't been funded properly, or maybe to the capacity that they should be. Where do you think the previous package failed? Small businesses, for example.
Yeah. Well, the PPP program is the right idea, and it's a good program. But the way it has been administered wasn't exactly the intention of what we had, which was for it to reach every single small business that was out there, mom and pop shops, people who were self-employed even. But since it had to go through the banking system, many of the banks chose to loan and deal with the folks that they already had a lending relationship with. And so what ended up happening is we saw a lot of folks who were maybe the most sophisticated, who maybe didn't need the money as immediately or had maybe more reserves to pull upon, that they were the first ones to be served. And I want them to get that money too, don't get me wrong, but we wanted to reach everybody with this. And there's still money available right now. So if there's anybody out there who is looking for a PPP loan, there's still money available and you should consider doing it. But that maybe wasn't the most efficient way for us to get that money to every small business, right? And so that's what we are looking at right now is what are the changes we need to make to the PPP program, to maybe adding another program so that we can keep people employed, because keeping people employed also keeps them on their health care, and on their health insurance. And also, when we start to reopen, those businesses don't have to go around and try to find employees, try to track down who they had, because that's going to be a big slowdown as well. And so we did two things in that last package. We really plussed up the unemployment insurance so that you got more $600 a week more than
Mm-hmm.
you previously would have to try and really cover the costs. And so for many folks who lost their jobs, that has worked. Although I know a lot of folks have had a hard time getting through to the unemployment office, the Texas Workforce Commission. And then we tried to have the PPP program so that as many small businesses as possible could keep their folks on the books. But I want to be clear about this too. I mean, there's no level of stimulus that we could pass that's going to beat the virus.
Sure.
We have to go out and win the public health battle. And that's what I really mean. That I think is the most important aspect of this that we always have to remember is that all of our programs are good and we need to do them and we need to provide them. But that we have to always think, what are we doing to beat the virus and how are we going to be aggressive? Because that's what really will restore the economy. I mean, we can try to help out the airline industry, which we did,
Mm-hmm.
but nobody's going to fly until there's confidence.
Right.
And that's the only thing that will really help them get back into business, right? And so our economy and our public health are linked. And to me, everyone should be demanding, where are the tests? Where's the contact tracing? Where's the aggressive effort to get us past this, to save lives and to restore confidence? Because that is how we win this thing.
Yeah, no, and I think you were right on the mark with that letter to the Department of Human Health and Human Services. I think that's I'm glad that you did that. So I kind of want to switch things up just a little bit. Try and it's already times are already dark to begin with.
Yeah.
So can you tell me what your favorite Dallas local restaurant is?
Yeah, it's Gloria's. My wife and I, love to go by there. We live close by, and so we could walk to it. And I have to be honest, though, that was pre-baby. So now, if we want to go to Gloria's, it's a different walk, and we can't have a margarita and all those things. So, or we have to get a babysitter.
Yeah.
And so, it has kind of changed a little bit, but I miss sitting out in the patio at Gloria's having a margarita and just kind of enjoying, Greenville there. But, now we're kind of more of a takeout family. So,
Gotta be, right?
yeah, I mean, because then you can put the baby in the car seat or one person can go and come back. So, I mean, I've been spotted many times at Velvet Taco and Rusty Tacos over there and also Torchy's, all kind of the taco places in like a small area in East Dallas. That's kind of like my area. That's where you'll usually see me, heading out to get a pickup order or something like that. And that's just kind of where we are right now. I think when
Yeah.
most parents of young kids, we're not really the going out set at the moment.
Sure. Yeah, I would imagine even with, a newborn or a young kid, even before this, you probably weren't trying to make that
Well,
happen.
we tried, but now it's a lot harder. So.
Yeah, I bet. You mentioned that they're playing baseball in Korea right now. You have a unique take on this because you are a former professional football player. What do you think what do you think about sports opening back up? I mean, do you think the NFL should move forward in the fall? I mean, what's your take on that?
Well, we're gonna have to see. We're gonna have to see what's going on with the virus and if it's still widespread. And areas that are still widespread, packing 65,000 people into sitting next to each other in very small seats. I mean, if you've ever gone
Yeah.
to a game, you know how narrow the seats are.
Yeah.
I mean, that would be a big health risk. And so again, I think for policymakers, it's not our ideas, right? It's what the healthcare experts tell us. And if they're telling us that would be a dangerous thing to do, then we shouldn't do it. But what they're doing in South Korea and what they're going to start doing in Germany very soon with soccer is they're playing with empty stadiums.
Yeah.
And, it's not the same, but the sport goes on, right? And I think that may be something we have to start with and kind of see how things go. I know that's going to be something that's going to be a lot of pushback, most likely from the leagues, because they get a lot of money to these, to the stadium, spending money there. And it's important for the local economies where these stadiums are. I get all of that. But if the healthcare experts are telling us that that's going to be a dangerous thing to do, then, one, person in South Korea recently was had COVID-19
I
and
saw
went
that.
on a bar crawl and
Reddit.
infected 40 people,
Yeah.
right? And so that's just what we're talking about here is how this disease is so contagious and it's so easily transmissible that if that's still going on, which it likely will be, I just can't see how that would be a safe thing to do.
Okay. I know your time is tight, so I just want to get one last question in.
Sure.
Thank you again for taking the time. It's kind of a two-part question. Um, I'm curious to know if you're familiar with the National Independent Venue Association that's been started during the pandemic, and how it is kind of giving a voice to independent venues. Dallas really right
Yeah.
before this, one thing I'm kind of bummed about is right before this, Dallas really had a thriving, healthy, music and arts
Yeah.
scene. And so now, of course, there are plenty of um, venues in Deep Ellum and Bishop Arts and Lower Greenville that very well could not make it through this. So I'm curious to know what your thoughts on that. And then the second part of that question is, do you have a favorite um, local venue, whether it's Granada, Three Links?
Yeah. I'll have to say the Granada because we had some events there during my campaign, and they've always taken care of us, and great, obviously historic building, and but you're right, we did have a thriving and really emerging scene, and I'm hopeful that through whether it's city or state or federal aid, that there's something we can do to try and make sure that we don't lose these really important emerging parts of our cultural kind of economy that we have. Because you think about Dallas, it's now becoming a destination for things that it wasn't before, and that's great. That's great for us. It's great for our city. It provides obviously a lot of entertainment, but it also provides a lot of jobs. And
Yeah.
I think those are the kind of things that when we have in mind, when we're thinking about what we don't want to see go, it's things like that. And some of the stats that we're seeing right now of the potential for maybe 30-40% of our restaurants, not just in Dallas but across the country, not being able to make it through this. I mean, that's a really really crisis point. And so those are probably some areas where anything that is affected by people gathering, so whether it's sports stadiums like you mentioned, whether it's venues, whether it's restaurants, anything that people have to gather to do is going to be deeply hurt by this crisis. And so we need to find the policy ideas that reach specifically to them and just get them through it. That's basically what we got to do. Just get through it so they can reopen. And that's a different kind of approach to doing these things than we have in the past, where we think um, we'll provide you with some help, but you got to get through it yourself. But basically, these have been closed down through no fault of their own, right? They're closed down either by county orders or they're closed down by people not being willing to go, right?
Right.
And so that I think falls into a totally different category where we really need to support them. I would hate to see that scene be squashed in Dallas, and I would hate for us to lose that kind of energy that we were picking up. And so I'm glad you raised it. I'm actually going to have a mental note to kind of look into it because I think it's a really good idea, and it's the kind of thing that will require a specific, kind of targeted support.
Hmm. All right. Well, Congressman, thank you again so much for taking the time. And thanks for all your hard work right now. I don't envy what you're having to do. So thank you again, and we'll be in touch soon.
Absolutely. Thanks, Doc, and
Thank you.
stay safe up there.
Thank you. You too.
All right. Bye.